This video is on the anatomy structures of Chapter 1, which is mostly anatomical terminology. First, we're going to look at body positions. The anatomical position is the position when a person is standing with their palms forward and their toes forward and their feet about shoulder width apart. The prone position is when a person is laying face down with their palms down. The supine position is when a person is laying face up with their palms up. Next, we'll look at planes and sections. The coronal plane is an imaginary line that divides the body into a front and a back, or what we call an anterior and posterior section. The sagittal plane is when an imaginary line divides the body into a right side and a left side, or a right section and a left section. This imaginary line does not have to be down the midline of the body. It can be off to the right or it can be off to the left, but it divides the body into a right and a left side. A midsagittal plane is the imaginary line that divides the body into an equal left and right section. An oblique plane divides the body into a superior and inferior section, or a top and a bottom section. But the line, the imaginary line that goes through the body, is at an oblique angle, so it's not completely horizontal, it's an angled line. A transverse section divides the body into a superior and inferior section, but that line is horizontal. So it's horizontal to the perpendicular line, which is the axis of the body. Next, we'll look at anatomical directions. Anterior is a direction that moves towards the front of the body. So we could say that the chest or the breastbone is anterior to the shoulder blade. Posterior is the direction moving towards the back of the body or something that's on the back. So we could say that the shoulder blade is posterior to the breastbone. These next two, which are distal and proximal, will be used only when we're referring just to an arm or just to a leg. So distal means distance away or further away from where the arm or leg attaches to the trunk. So to move distal on the arm, that direction would be towards the fingers. And to move distal on the leg, that would be to move towards the toes. So in the arm, the elbow is distal to the shoulder, and the wrist is distal to the elbow. And in the leg, the knee is distal to the hip, and the ankle is distal to the knee. Proximal is the term we used when the direction is toward where that limb attaches to the trunk. So in the arm, it's towards the shoulder, in the leg, it's towards the hip. So the shoulder is proximal to the wrist, and the elbow is proximal to the wrist, and the hip is proximal to the knee, and the hip is also proximal to the ankle. Inferior is a term that we use when we're talking about the entire axis of the body. And so inferior means towards the foot. So we could say that the navel or the belly button is inferior to the nose. Superior is the opposite direction that's going towards the head. So we could say that the nose is superior to the knee. Lateral is a term that we use away from the midline of the body. So we could say that the shoulder is lateral to the breastbone, or the ear is lateral to the nose. Medial is the exact opposite term. Medial means towards the midline of the body. So we could say that the breastbone is medial to the shoulder, and the nose is medial to the ears. Deep refers to moving in towards the middle of the body, away from the surface of the body. And so the skin is more superficial, and anything underneath the skin would be deep. So the abdominal organs are deep, whereas the skin is on the surface. So the opposite of deep is superficial. The skin is superficial. So whenever we're moving towards the skin, that's moving in a superficial direction. Next, let's look at body regions. The first region is the lumbar region. This is in the low back area. Next, we have the sacral region. It's just below the low back. So the lumbar region is going to be that curve that curves into the body. That's the lumbar region. The sacral region is right below that. It kind of curves out, and it is just medial to the buttocks area. The scapular region is the region over your shoulder blades. The triangle of auscultation are the areas where a doctor would listen with a stethoscope, and they're right at the base of the scapular region. So they're kind of right at the base of your shoulder blades. The vertebral region is the region where the spine is, and so it runs all the way from the base of your skull down to your tailbone. Next, let's look at the head region. The auricular region is the region around your ears. The buccal region is your cheek, or your area of your cheek just outside your teeth. The cranial region is your skull, the top of your skull in the back. It doesn't include the facial region, which is the bones in your face. The facial region includes the bones in your face. The frontal region is part of the cranial region. It's your forehead area. The mental region is the tip of your chin. The nasal region is your nose. The oral region is the area around your mouth. The orbital region is the area around your eyes. The parotid region is the area, so the buccal region is a little more anterior to the parotid region. The parotid region is between the buccal region and your ear, so it's just a little bit further back, sort of over the body of your mandible, but it's just a little more posterior than the buccal region. The perineal region is the region over your genital area. Now we have the neck regions. The anterior cervical region is on the front of your neck. So cervical means neck and anterior is in the front, so that's the anterior cervical region. The lateral cervical region is just lateral to the anterior cervical region. And the posterior cervical region is the area of your neck on the posterior side, and it does have a little bit on the lateral side as well. The sternocleidomastoid region is a region in your anterior neck, and part of it's also in the lateral cervical area as well, but it's the area that is made up of the sternocleidomastoid muscle. That is the muscle that feels kind of like a rope in your neck. If you turn your head to the side a little bit and you palpate, you can feel this rope-like structure that's called the sternocleidomastoid or SCM muscle. And overlying that area is the sternocleidomastoid region. Next, we have the thoracic regions. The axillary region is the region under your arms, so it's your armpit area. The pectoral region is the region that overlies your pectoral muscles, or just lateral to the breastbone, and it has it just is on the right and the left. So there's two pectoral regions, the right pectoral region and the left pectoral region. The thoracic region includes the pectoral region, and it includes both the anterior side of your thoracic area and the posterior side of your thoracic area. Now we'll look at the upper limb regions. The antebrachial region is your forearm on both the front and the back. Your brachial region is your arm on both the front and your back. So the arm is from the shoulder to the elbow. And so the brachial region includes that area other than the shoulder muscle called the deltoid, which is right on top of your shoulder. The carpal region is your wrist area. The cubital region is the region around your elbow on the front and the back side. The deltoid region is that muscle area over the shoulder. The digits of the hand are the fingers and the thumb. The dorsum of the hand is on the posterior side of the hand. So dorsum of hand region is on the back side, the posterior side, if you're standing in the anatomical position. And then the palmar region is the exact opposite. If you're standing in the anatomical position, the palmar region is on the palm side or the front of your hands. The upper limb region is the entire area that includes the deltoid region, the brachial region, the cubital region, the antebrachial region, the carpal region, and the hand region, which includes both the palmar and dorsal side and the digits. Now we'll look at the lower limb regions. The ankle region is the region between your leg and your foot. The anterior leg region is on the anterior side of the leg. So the leg is the lower portion between the knee and the ankle. The digits of the foot are the toes. The dorsum of the foot is on the top side of your foot. The femoral region is the thigh area. So you have the femoral region and then you have the leg region. The leg region is below the femoral region between the knee and the ankle. The gluteal region is the buttocks. And this is the entire lower limb. It includes the buttocks, the femoral region, the popliteal region, the leg, the ankle, and the foot and digits. The popliteal region is the area behind your knee. The posterior leg region is on the back of the leg. Sometimes this is called the sural region, whereas the front is sometimes called the crural region. The sole of the foot is on the bottom of the foot. And then we'll look at body cavities. So there's two basic body cavities. There's the dorsal cavity and the ventral cavity. And the dorsal cavity includes this cavity, which is the cranial cavity. The cranial cavity is the skull, which is going to enclose your brain. And then there's the vertebral canal or the vertebral cavity. And this is the cavity that houses the spinal cord. So the cranial cavity and the vertebral cavity are the dorsal cavity. They're in the dorsal cavity. Then the rest of the cavities are in the ventral cavity. The ventral cavity includes the thoracic cavity. The thoracic cavity is going to include the area where your heart and your lungs are. The pulmonary cavities are inside the thoracic cavity. So there's a right pulmonary cavity and a left pulmonary cavity. The mediastinum or mediastinum, however you say it, I say it mediastinum. The mediastinum is the area in between your two lungs. That's where the heart will be, and that's where the major blood vessels of the heart, plus the windpipe, which is called the trachea, and the food pipe, which is called the esophagus. They would all be found in that mediastinum area. The diaphragm is a muscle that divides the thoracic area from the thoracic cavity from the cavity that's right below that, which is called the abdominal pelvic cavity. So this is the abdominal cavity, which is part of the abdominal pelvic cavity. And just below that is the pelvic cavity. And together we call those two areas the abdominal pelvic cavity. So that the abdominal pelvic cavity includes the abdominal cavity and the pelvic cavity. Then the diaphragm separates that cavity from the thoracic cavity. Let's look at abdominal quadrants and regions. Quadrants divide the abdominal pelvic area into 4 quadrants, and these quadrants are make it easy for health professionals to describe where pain is or where issues are occurring in the abdominal pelvic area. So if we use one vertical and one horizontal line, we can see that it divides the body into 4 quadrants, and we can label them as left lower quadrant. And so this picture is showing left lower quadrant. Now you might look at that picture and say that's on your right, so shouldn't that be the right lower quadrant? But it's actually that person's left side of their body because they're in the anatomical position facing you, so their left is your right. So this is their left lower quadrant. This is their left upper quadrant. This is their right lower quadrant, and one of the structures in the right lower quadrant is the appendix. So when a person complains of right lower quadrant pain, it could be appendix or appendicitis. And then this is the right upper quadrant. And the right upper quadrant is the gallbladder. So people might complain of right upper quadrant pain when they have something going on with their gallbladder. We can also divide the body into 9 different regions by using 2 vertical lines and 2 horizontal lines. In this case, health professionals don't typically use these terms, but more anatomists will use these terms because they can be much more specific. So when we look at this, it kind of looks like a tic-tac-toe. The middle region is called the umbilical region. The region above the umbilical region is the epigastric region. Epi means on top, gastric means stomach. The area below the umbilical region is the pubic region. The area to the left of the umbilical region is the left flank region. And the area to the right of the umbilical region is the right flank region. Then we have the area in the lower left corner, and that's the left inguinal region. And on the right, it's the right inguinal region. Then in the top left corner, we have the left hypochondriac region. Hypo means below, chondriac means cartilage, and the rib cage has a lot of cartilage associated with it. So this is the left hypochondriac region. And on the opposite side, we have the right hypochondriac region. Next, we'll look at the serous membranes. The pericardium is the serous membrane that surrounds the heart and the pericardial cavity. So this is the pericardial cavity. It's in the mediastinum, and so the heart is inside the pericardial cavity. And the pericardial cavity is created by 2 membranes, a visceral pericardium and a parietal pericardium. The outside here is the parietal pericardium. So the parietal pericardium lines the pericardial cavity, whereas the visceral pericardium is attached to the heart itself. And then in between the visceral pericardium and the parietal pericardium is a space that we call the pericardial cavity, and that's filled with a serous fluid. Next, let's look at pleura. So this is the pleural cavity. There's 2 pleural cavities, one on the right and one on the left. And then there's a serous membrane that surrounds the pleural cavity. And the visceral, or the parietal pleura, we'll start with that first. The parietal pleura, it's going to line each individual pleural cavity. And then we can see where the parietal pleura is going to be continuous then with the visceral pleura. And that's up near where that primary bronchi, where the trachea splits. So that's where the visceral pleura is continuous with the parietal pleura. And so the visceral pleura is on the inside. It's attached to the lungs. And then so it covers the lungs, whereas the parietal pleura lines the cavity itself, lines the pleural cavity. Next we have the peritoneum. The peritoneal cavity is the space in the abdominal area that contains most of the abdominal cavities. Some of the abdominal cavities are retroperitoneal, meaning they're outside of the serous membrane. The parietal peritoneum is the layer of the peritoneum, or the layer of that serous membrane that lines the outside of the peritoneal cavity. And then the visceral pleura is the membrane that surrounds the individual organs inside the abdominal cavity. Next, we're going to look at organ systems. There are 11 organ systems that we're going to be looking at. This is the integumentary system, which includes the skin, which is the epidermis, the dermis, and the hypodermis, and all the accessory structures like sweat glands and hair and sebaceous glands. The skeletal system includes the bones, the skeletal bones, so the bones of the skeleton plus all their associated cartilages. The muscular system consists of all the skeletal muscle in the body. Skeletal muscles are typically attached to bone, though some of them can be attached to soft tissues like in the face. There's some muscles that are not attached to bones. Those are the muscles of facial expression. The nervous system consists of the brain and the spinal cord, and all of the nerves that come off of the brain and the spinal cord. The endocrine system is a system that has glands and organs that secrete hormones. And so there are the areas in the brain like the hypothalamus and the pituitary. There's areas in the neck like the parathyroid and the thyroid glands. The thymus gland is overlying the heart blood vessels. Then there's the pancreas and the kidneys and the adrenal glands. And then in the male, there's the testes, and in the female, there's the ovaries. The cardiovascular system includes the heart and the blood vessels and the blood. The lymphatic system includes some lymphatic organs like the tonsils and lymph nodes and the spleen and some tissues in the intestinal area called MALT and the thymus. And so, and then there's also all these lymphatic vessels. And there's some major lymphatic vessels like the thoracic duct and the right lymphatic duct and the cisterna chyli. This is the respiratory system, which includes the airways like the nasal cavity and the pharynx and the trachea and the lungs and the larynx. This is the digestive system. This is going to include the oral cavity and the throat, which is the pharynx, and the esophagus, and then the stomach and the small intestine, large intestine, rectum, and anus, as well as accessory organs like the liver and the gallbladder and the pancreas. So the pancreas is part of the digestive system, and the pancreas is also part of the endocrine system. The urinary system consists of the kidneys and the ureters and the urinary bladder and the urethra. The female reproductive system includes the uterus and the ovaries and the uterine tubes, as well as the mammary glands. And the male reproductive system includes the penis and the testes and the ductus deferens and some accessory glands like the prostate gland and the bulbourethral gland and the seminal gland. This ends this video on Chapter 1, Anatomy Structures.